morning, good morning, good morning. Time check it is 12 minutes past 10. This beautiful Monday morning. And welcome to Radio Doctor on Women Radio 97.1 FM. 91.7 FM rather. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise you on women radio. The program airs every weekday from 10 a.m. I'm your host, Hassan Matule, and it's a pleasure to have you join us. Today's topic is hand, foot, and mouth disease, a common viral infection that mainly affects babies and young children. If you've noticed the sudden appearance of fever, painful mouth sores, and rashes on a child's hands and feet, that's what today's topic is all about. We'll discuss how to recognize the illness, how it spreads, how to care for an infected child at home, and the warning signs that should never be ignored. Joining us today is our guest doctor, Dr. Olufumilola Akinola, consultant pediatrician at St. Ives Family Hospital. The phone lines will be open shortly to join the conversation or to ask Dr. Akinola your questions, but you can send your messages to 08155917917 or 0703 175 So do stick around with us. We are live on YouTube at WFM 917, or you can listen to us on the go via our website www.wfm917. Good morning, Dr. Akinola.
Good morning. Happy to join you once again this morning.
Okay, it's nice having you on the program, Doctor. So, Doctor, what exactly is hand, foot, and mouth disease?
Um, Hand, foot, and mouth disease is a highly contagious viral illness that mostly affects young children under the age of 5 years. Though it can affect any other age group, especially children, but it usually affects most children under the age of 5 years. It is characterized by low fever, painful mouth sores, and a distinct skin rash on the hands and feet.
Okay, thank you, Doctor. What causes it, and is it the same as foot and mouth disease seen in animals?
Um, it is caused by a viral by a virus, and is different from the foot and mouth disease that are seen in animal. And because it is not transferable directly from animal to humans, their own hand and foot disease is different from the one you see in children.
Okay, Doctor. Is it a seasonal illness or can it occur at any time of the year?
I would say that it's a seasonal disease,
Illness.
but it's not a seasonal illness. But most viral disease, in this part of the world, it's common during the hot season, during the time that the hot season, and sometimes it can be sporadic and just occur without following a specific pattern.
Thank you, Doctor. How contagious is the disease, and what are the earliest symptoms parents should look out for?
Um, it's a viral disease, and it is usually transmitted through uh, contact, either when the person that, I mean, through usually transmitted through contact, when someone carrying the viral illness, touches a surface, and through that it is transferred to other person, especially children, that go to crèches where you have a close contact of children coming together, either in school, um, in crèche, where you have a lot of them coming together. So through inhalation, either by coughing, of the virus, and close contact, on of surfaces. Through that, the virus is transmitted from one person to another.
Okay. What do the mouth sores and skin rashes typically look like? And does every child develop rashes?
The rashes for um, the rashes occurs in small blisters, and on the palms, in the hands, and the sole of the feet, and sometimes on the buttocks or genitals. And the rash usually does not itch. That is the typical symptoms of the rash. It can be hyperemic. I mean, it is red, but affecting the hands, the palms, and the small fingers. And it can also occur at the soles of the feet, and sometimes the buttocks or the genitals of a child that is affected. But it is not usually associated with itch, unlike some of these blisters that are caused by inflammation or allergy that now associated with itch. But this one is usually not associated with itch. And just as I said earlier, it is transmitted with through respiratory droplets, either by sneezing, coughing, or saliva of the person that is affected, and contact with fluid from the blisters or the stool of an infected person, or touching of contaminated surface or objects such as toys, dog knobs, and after touching the face, touching the blisters, and when to go and contact another person that doesn't have that. Through that, it's easily spread from one point person
Mm.
to another. That is why it's school where you have a lot of children coming together, or crèche, where they can easily share this viral illness from one person to another.
Okay, then, doctor, you mentioned now that touching the blisters can spread it, touching the stool or any respiratory fluid. So, my question now is, the parents or guardian would obviously take care of the child. Can older children and also adults become infected? And how can we tell the difference between this disease and chickenpox, measles, or other common childhood rashes? Because Blisters, I feel blisters are also common with measles and chickenpox. So we might think they are the same thing and be treating the child wrongly.
When it comes to other disease with experience as a medical doctor, the pattern and the the classical presentation, of other disease differs from the mouth and the hands and mouth uh, syndrome. I mean, foot disease. You know, for example, chicken pox have its own pattern. It is the pattern of rash differs from what you see. It contains blisters, but you also see some other pattern of rash coming together when it comes to chicken pox. And the appearance of rash usually follow um fever, and at the same time, the fever, the rash usually starts, you know, the distribution of rash, we say it is centripetal for chickenpox, but the distribution of rash differs when it comes to the hands and mouth disease, and so through physical examination, through proper history, a doctor will be able to distinguish hand and mouth disease from chickenpox, and also the age of appearance also help us to make a proper diagnosis between these two form of rash. And the organism that cause both differ. Though they are both viral illness, the hand and mouth is usually caused by Coxsackie virus, while chickenpox, is also caused by another type of virus.
Okay, doctor, to my first question, can older children and adults also become infected, especially when they have close contact with infected children?
Yes, but for older children that has not developed immunity against the causative virus, which is Coxsackie virus, yes, can develop this type of rash too with fever. But by the time most older children and adults would have developed immunity against this viral illness. That is why sometimes they don't develop uh, the disease despite exposure.
Okay, so how long is an infected child contagious?
Um, for um, for um, uh, the condition is usually mild. It's resolved on its own between 7 to 10 days. But between the first 5 days, even of the appearance of the rash, that is when this child is usually contagious.
Okay, doctor, thank you very much for this insightful conversation. What hygiene practices help reduce the spread of the infection?
We mentioned earlier that this rash is usually, you know, uh, transmitted through respiratory droplets by coughing, uh,
Sneezing.
sneezing, you know, from especially someone that have the disease. So when whoever is coughing should please try as much as possible to use uh, face mask, you know, to cover the nose and mouth. Though it may be difficult for children, especially children under the age of 2 years, to follow to use face masks so that it won't
I was
affect,
actually going to ask how
you know,
children would
their
use face
breathing.
mask.
Well, for older children, even adult that is coughing, you know, uh, easily you transmit this viral illness, even bacterial illness through especially those that can be transmitted through respiratory tracts. Use of face masks will help us, to sort of contain the spread of this disease. Then, from contact with fluid and blisters of infected person, proper hand washing, will help us, to reduce the spread of this disease. Um, our children should be taught, to wash their hands before food, after, I mean, touching a soiled, uh, working in an dirty environment, after visiting uh, the bathroom or the toilet, they should know how to wash their hands, so as to prevent some of these uh, 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 disease that can be spread from hand to mouth. So hand washing too also have a way uh, of preventing the spread of this disease. And also, as at now, there is no vaccination against uh, and food and food disease. So, hand washing with soap and water, especially after changing diapers for mothers, or after using toilets for the children, is very important, you know, to prevent the spread. Cleaning and disinfecting chair toys, surfaces, doorknobs regularly is also uh, very important in preventing the spread of this disease. Avoiding close contacts, such as hugging, kissing, or sharing utensils with infected individuals, also have a way of preventing disease. And seeking, keeping sick children home from daycare or school when they have been fever free for at least 24 hours and their blisters have started to dry. You know, I mentioned earlier that um few days before the fever and before the uh, blisters totally dry off is when this disease is contagious. So, um, as much as possible, children that have hand and foot disease should uh, be isolated at home when we notice such blisters, so as to prevent the spread in school and crèche. So that's the best way, or the area where these children get in close contacts with other people apart from their family members, that can encourage the spread of this disease.
Okay, the phone lines are now open. You can call us on 07000 or 0800 or 09155917917. You can send a text or WhatsApp message to 08155917917 or 07031756537. If your child has unexplained mouth sores, fever, skin rashes, or you have been told they have hand, foot, and mouth disease, this is your opportunity to speak directly with our guest doctor. Please do call in with your questions or send text messages. Okay, so doctor, since it's caused by a virus, are antibiotics useful?
Um, for most viral disease, uh, there is, I mean, there is no use for antibiotics in the treatment of any viral disease unless that there is secondary bacterial infection. So antibiotics is not useful. And for most hand and foot disease, usually lasts between 1 to 7 days within a week, usually run its course, and most of the time you don't need uh, any uh, medication.
Okay, also, what food and drinks are best while the child is recovering?
The most important thing uh, is better, I mean, to get a pain relief in case there is pain, or for the fever. If child is running fever of 5 degree, we may need to give antipyretic. Um, for sometimes it's usually associated with sore throat, then it's better. I mean, for that, for the relief of the sore throat, for child that can gargle, or uh, can use uh, can gargle with warm salt, or use numbing uh, throat spray and mouthwashes. Uh, Hydration is very, very important. Uh, Patients should drink plenty of fluids. You know, cold drink may be helpful. Use of ice chips, uh, popsicle, it can simultaneously soothe the mouth and sore, and keep uh, the mouth hydrated. Uh, it is when it comes to food, it is advisable to take soft food like yogurt, soup, mashed potato, and as much as possible, avoid spicy or highly acidic food such as citrus juice.
Okay, thank you very much, doctor. What signs should prompt parents to take their child to the hospital immediately?
If fever persists, lasting more than uh, this child is having high fever and is persisting more than a week, the child is not eating rather than getting better, it's getting worse. It's not taking any food. Uh, if the child is dehydrated, if the child is vomiting, and fever persists more than a week, please take this child to see his or her doctor.
How can parents help relieve mouth pain and encourage children to eat and drink?
I mentioned it earlier that for mouth pain, especially when they when they have sore throat or blisters in the mouth, uh, for those that can obey instruction, you can gargle with warm salt or water using numbing throat sprays or mouthwashes. Use of cold drinks like ice chips, um, popsicle. Uh, this will it will suit the mouth sore and at the same time keep the child hydrated, and also ensure that you give enough fluid for this child so that this child will stay hydrated all the time.
Okay, time check. It is 39 minutes past 9 this beautiful Monday morning, and you're listening to Radio Doctor on Women Radio WFM 91.7. You can listen to us on YouTube at WFM 917, or you can listen to us on the go via our website www.wfm917.com. Okay, so doctor, is there anything parents should avoid doing when caring for a child with this disease we have been discussing?
Pardon, please.
Third, is there anything parents should avoid doing while caring for a child with hand, foot, and mouth disease?
Um, I mentioned earlier, hand washing is very important. Changing diaper, after visiting toilet, please ensure that you wash your hands as the parent that is taking care of this child. And also for older children, they should be taught how to do a proper hand washing. Then please isolate this child during the time the child is having this illness so that he won't go to school to continue to spread the illness to others. And please let's give soft diet, soft, not too salty and not too acidic food. Give bland food, you know, more of yogurt, soft diet, that will keep this child hydrated and also be enough to provide the nutrients that this child needs during this illness. Um, Also, for the person taking care, use of mask, is also very important to prevent the spread of the disease. And let's keep our environment clean to prevent the spread of disease. And do not share utensils such as cups, towels, spoons during this period. It can easily help in spreading disease. And if symptoms wasn't last longer than 7 days, or if there is sign of dehydration in the child, And if this child is not taking enough, please visit your doctor as soon as possible.
Okay, thank you very much, doctor. Can traditional or home remedies make the condition worse?
I've never tried traditional medicine, and I don't know which kind of traditional medicine or home remedy you want to give the child, you know. But what I would say is that following simple outlines, just as outlined before, you know, keeping child hydrated, preventing high fever by using over-the-counter medication like paracetamol, giving enough fluid, and let this child rest properly is enough to take care of this disease, because it's usually mild and usually run its course within the 1 to 7 days.
Finally, doctor, what one message would you like every parent listening today to remember about hand, foot, and mouth disease?
Um, I will summarize by saying that hands and foot disease is a viral illness that is caused by Coxsackie virus, usually affect children under the age of 1 to 5 years. It can affect older children and even adults, but when it affects adults, usually mild. Some of them may not even show symptoms, because by this time, most of them would have exposed to this virus and they would have developed immunity against the virus. Usually cause blisters on the mouth, on the hands, the palm and soles of children. Usually causing fever and rashes on the body and mouth sore, but usually mild. And within 7 days, the rash develop after fever, and by 7 days,
Hmm.
all this would have started drying. So it is spread by respiratory, from coughing, sneezing, saliva of the infected person, and hand to mouth transfer of viral illness after touching a contaminated surfaces. So, as a mother or parent, please ensure that you wash your hands after changing diaper. Teach your children proper hand washing. Isolate children that have this rash to prevent them from spreading to other children. Prevent use of share of utensils, cups, spoons, towels during this period to prevent the spread of diseases.
Okay, thank you so much, doctor, for joining us today and for helping parents better understand hand, foot, and mouth disease. To our listeners, remember that while this illness is usually mild, recognizing the symptoms early, keeping your child well hydrated, practicing good hygiene, and knowing when to seek medical care can make all the difference. Thank you for listening to Radio Doctor on Women Radio 91.7 FM. I'm
Thank you.
Hassan Natula. Do have a healthy day. Good morning.
Thank you for having me.
Unwanted touching, hugging, patting, or brushing against the woman is harassment. Respect boundaries, respect women. This message is from Women Radio